Hey everyone, in this video I'm hoping to cover um, a lot of the pages that we've learned on the heart in the textbook videos. So this is going to be a longer video. Again, the complete anatomy videos are meant just to really give you an overview on what we're talking about. A little bit more in-depth stuff will be in the textbook videos. Um, but let's go ahead and let's just get started. So in this view, we see the heart, and then we see the diaphragm, and then we see in yellow the phrenic nerves coming down both sides of the heart. Just to kind of skip ahead a little bit too, back here we have the superior phrenic arteries. These arteries are what kind of supplies blood to the diaphragm, and we have superior phrenics, but we also have um, inferior phrenics that you'll find underneath the diaphragm through here. I imagine here shortly I'll be creating another video going through the diaphragm and all of these different openings in it and just going through those. So let's get rid of the diaphragm and let's get rid of all of these arteries, nerves. All right, so on top of the heart, we have the pericardium on here. This is going to be the fibrous pericardium. And then if you remember the layers of the heart, so this is going to be the outside layer. And then underneath it, we're going to run into the parietal layer of the serous pericardium, which encases the heart. And as you can see, it's surrounding it, all of it. And then, so we took off this serous layer, the parietal layer of the serous pericardium, and this is going to be the visceral layer of the pericardium. And in between those, you're going to have pericardial cavity, which is in between the visceral and parietal layers of the serous pericardium. We get rid of this. All right, so here we have the heart. Let's just go through the arteries and some of the veins on the outside of this. So what you're looking at right here, that is going to be your right ventricular, um, where that would be. Coming up here, this is going to be your pulmonary trunk, and then this is going to be that ligamentum arteriosum, or ductus arteriosus when you're looking at a fetus. This is where the blood bypasses, since we're getting the oxygenated blood from the mother. Uh, and so that blood will come through that ligamentum arteriosum into the aorta and just be divided out among the body, since we don't need the blood going to the lungs because we're not breathing air in the feet and um, inside the womb. So, but to the left of it, we're looking at the aorta, and we know that the aorta, just past the aortic semilunar valves, we're going to get the coronary arteries. Okay, and those coronary arteries are going to supply the blood to the heart. So if we look at the left coronary artery, which is just right here, that's going to give blood to the anterior interventricular artery. So that wall that divides the left ventricle, the right and left ventricles, you have that interventricular septum, or the wall between them. You're going to have the anterior interventricular artery, and then you're going to have a vein that sits right on top of that. If we rotate this back, where we see that septum coming all the way down through, we'll also have another artery and vein, but this is the inferior, or some people even call it the posterior interventricular artery and vein. But coming back to this left coronary artery, it's going to supply blood to the circumflex artery that wraps around the heart. And we have that left marginal branch artery. That circumflex artery continues. If we rotate back and look at the right coronary artery, you can see it coming right out of the aorta, but then it comes down and back around. And here's our right marginal branch that comes off the coronary artery, and then the inferior and interventricular artery. As for veins go, you get this great cardiac vein, or this coronary sinus. The coronary sinus is what leads to that great cardiac vein. So this great cardiac vein then supplies a drainage for that interventricular vein, and then it's coming through that ostium of the coronary sinus right into that right atrium. All right, let's go ahead and take these off. Now we'll just dive right into the heart. So from what we know, let's go through the blood supply back into the heart. What you're looking at right here is the right atrium. Down here is going to be the inferior vena cava. Up here is superior vena cava. If we rotate this, you can see that a little bit better. This hole is for your azygous vein, which drains a lot of the blood in the thoracic region. Dumps right into that superior vena cava. So we're going to go ahead and open this up. Here's your right atrium. This is what it looks like. So, besides having that inferior vena cava right here and the superior vena cava up here, we have fossa ovalis and ostium of the coronary sinus. And then here's our tricuspid valve, or our atrioventricular valve, the right one, or the tricuspid valve. Whatever you want to use to distinguish this. We just know that the tricuspid comes from the three cusps that you'll see here. If we move on to where the blood then goes through, we're going to move into the right ventricle. So all of those cusps have chordae tendineae connected to them, and your papillary muscles is what's controlling those. Let's see if we can. So if we look at this, we can see that from that right atrium, we're getting those tricuspid valves opening up. Blood is coming right through that heart into, well, right through those cusps, right, into the next part of the heart, which is going to be this right ventricle, which from there, still deoxygenated, it's going to go through these pulmonary semilunar valves coming up, this pulmonary trunk, and these right here are where the pulmonary veins are going to be. And the reason they're called veins is because they are deoxygenated blood. That's what they're carrying. So they come out to the lungs, and then they come back to this right here. This is your left atrium, and you can see we've got two pulmonary arteries coming in from both sides, meaning they're both coming in to that atrium. So I just took out that one. Let's come back here. Actually, get rid of this one. So here we have the right atrium, or the left atrium, excuse me. this left atrium, there's your bicuspid valve or mitral valve or your left atrioventricular valve. Okay, coming through there, that blood's going to go through that cusp, and then it's going to come into that left ventricle. So you can kind of see one of them papillary muscles sitting right here, but it's connecting into that mitral valve, opening that up, and you can see between the two ventricles you've got this intraventricular septum. There is a muscular part, and then there's a membranous part. Muscular is going to be down lower, while this membranous is going to be up here. But through this right here, you can see that mitral valve right there pumping straight into the ventricle. But then here is our aorta semilunar valves, or aortic semilunar valves, coming through into the aorta, which is right here. If we get rid of this, we can see there's those semilunar valves right there pumping. And you can see the holes right here for your coronary arteries, left and right. And then blood will then get pumped through the aorta, and then systemic circulation. So that's the heart right there. We covered just the pericardium. We also went through some of the arteries and veins that you'll find on the heart. Hopefully this video helps, and if there was something I missed that you wish I would have covered, please leave it in the comments below, and we'll see you guys next.
Alright, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.